Well, I'm certainly glad to be here. I guess I'll talk this a little bit, but really just want whatever to answer the questions that you may have about whatever you might like to bring up or whatever. As you may have heard or read, I guess, in the newspapers, we have the new waivers that go into the regulatory process, so that's always interesting and fun. We can never predict what people may think or say about those. We do have some planned meetings were held with some families. We I guess you may know, you all were a part of the 63. We did 63 community forums and talking with groups about the new waivers and what they would mean. We were in every nook and cranny, I think, in the state, and speak before audiences that were, I guess, as small as 6 and as large as about 300. So to inform folks about the advantages of that, we spent a lot of time speaking with different legislators about those advantages. We have a lot more data about the implementation of parts of those waivers, like the Medicaid administration has already been implemented as a part of, but they're in the waivers. Hey, Pat. And what the waivers are, we'll talk. So one thing I'll talk about is the waivers. The other thing I like to talk about is the changes we're making in mental health, because mental health sometimes crosses paths with people with developmental disabilities, around folks with autism. So we'll talk about that. Talk about, and please hear what else I'm saying when I say this. You may say, well, I don't want to hear about anything else you're saying since you said that, but I want you to know where we're thinking, so take this kind of out of your mind. It's certainly one thing we're considering, just considering at consideration stage now, is a dedicated autism waiver. So we're looking at that sort of autism spectrum, simply because we have some people that are pretty high functioning with Asperger's, who are getting kind of none of the necessary services they should be getting for some places. And also there's the need to dedicate some service supports, because some of the children with autism, it just comes right across with mental health needs also. So it's always a really doesn't quite fit here, doesn't quite fit there sort of thing. And so we're just looking at that. There's been no promises about that, and that still would be a years off process. But to begin a years off process, as you know, this waiver process is 2 years and 4 months old or something like that. So that might give you some idea where we might be, and that we're a little bit farther down the line that I may be telling you about the thinking about what might happen with a dedicated autism waiver. But we'll talk some more about that. Managed care, probably need to talk to you, something about that. The governor put me on the health benefits exchange, which is a great big deal. None of my counterparts, there's 49 of us that have this job in the nation, and none of my counterparts, their governors had put them on that board. So that's nice. So that's people between 133% and 400% of poverty. That's families that are making, family of 4 making close to $90,000 a year, and between, I think, about $24,000 and $90,000 in that range. Then you'll have someone there that'll be advocating, of course, myself, for a package of health care services that insurance companies would provide. I'll be certainly advocating for service supports for your loved ones, and so that those make some sense. Well, and just on that vein a little bit, what we don't want to happen is, at least what I don't want to happen, or I don't think anybody wants it to happen, but if you don't make changes, it will. That is that we don't want whatever may be the needs of somebody, particular mental health needs, to drive a family into poverty, so that they have to come into the Medicaid state plan to be able to access the services that would have kept them out of poverty. That mostly relates to mental health, but so that's what I'm trying to prevent. As far as the general policy and service and supports for folks, trying to turn, as you know, you've all kind of experienced what we call cliffs. There's something called cliffs in human services. It simply says if you got all this, then you get all this. But if there's one piece you don't have, then it's like a cliff where you get nothing then, because you don't qualify because of this or that or that. So what we're trying to do is have an overall policy of how the cabinet's run in a way that tries to turn all the cliffs into slopes. That makes sense. So, do that. And then also, my new boss is Secretary Audrey Haynes, and she's, of course, absolutely fantastic. She will, without question, be the best boss I've ever had in my life. I think she will be. She certainly seems like that now. She's really something. And, she just believes that people ought to be in charge of things that they know something about. That'd probably be a good way to run government. So, that's kind of the days of people being in charge of things that they, because of a lot of reasons, that they put people in charge of things that don't know a lot about whatever they're in charge in, that hopefully they're over. And certainly, the popularity of Governor Beshear and the Beshear administration. So that goes without saying. I won't say anything that would in any way damage that. He, hopefully tonight on tape. He really is, is a wonderful governor. And know this absolutely the case, because I was there, that First Lady Beshear is the reason why Kentucky joined 43 other states to now be a state that has substance abuse treatment for people that have significant challenges. So the $17 million that the legislature put up to begin next year serving 4,500 people that have substance use treatment. People have mental health needs and substance use, because a lot of that's self-medication, all that. Defining Kentucky actually recognizing all that is real part. But anyway, getting to work directly with her, she's really something, and knows certainly has a lot of passion for the needs of people that have significant substance use problems. So, but anyway, maybe just talk about the waivers. Well, it's like no good deed goes unpunished, right? So when the waivers the regulations are passed and come through, then Kentucky will be among about 7 states will have the best waivers in the country. Yeah, they're good. They're not just sort of okay good. They're real good. We pushed every button that we could, which is, I think, just about every single button to offer every option possible. There's lots of stuff in that waiver that's going to give families an opportunity to ensure that other citizens throughout the community, for example, what's that one thing called, Claudia?
Natural support training.
Natural support training. There's a piece in the waiver that allows money to go. Let's say your child likes. Always use horses, but use horses is so costly around here. Because around horses, but every place else they use. Anyway, let's say your child likes bicycles. Let's try that. Okay, bicycles. What it will allow you literally to find out who all else is interested in bicycles: people who sell bicycles, people who make bicycles, people who belong to bicycle clubs, people who make cool shirts for people who wear bicycles and all that stuff. It would allow you to gather those people together if your son or daughter really likes bicycles, and to be able to have the money then to pay somebody, say $400 or $500 to come and talk about all the different ways somebody could work with bicycles, or to connect folks. So you can imagine if it works for bicycles, that means if you like horses, somebody that, from a tack shop would come, and different people, and you can just go to any subject matter at all. And it allows you now to not have to rely just on human service personnel and whatever skills they know, which is not many, because all we know is kind of what I'm talking about today, the human service side. But it allows you to draw on people that have large numbers of interests. Literally anybody in society could have the potential of informing you and your sons or daughters about something that might be useful to them. That's just one little slice of that's just one little slice of the waiver. There's a whole bunch of stuff like that in the waiver that you don't know about. No matter how much we tell you about it, it's like, wow, until you start seeing other families using it, and it's like, well, how did Raymond get to do that? How did that work? Until you see the combinations of the different pieces that are in the waiver, will you see that, wow, these things are really built for my son and daughter have the best shot of having a life in the community with the supports necessary, and to have people who love him or her besides people who are their family members or people who are paid to be with him or her. So that's what they're designed to do, is to increase the relationships with folks, and also to build on the gifts that your sons and daughters bring, not so that they're not seen as a package of deficits to be worked on all the time. You know, I mean, come on, it just gets, I mean, how'd you like to have autism and have somebody working on it, trying to fix you? It's like, come, back off, you know? As you know, that there's, you know, a lot of wonder and perfection with folks that have autism, and certainly and autism and autism spectrum disorders that the rest of us don't have, and that it's recognition of strengths also in that. So I'm not just talking though. You may think I'm just saying something nice. I'm not. I really do mean there's very specific pieces in that waiver that will allow other people to be engaged who are experts and are good at other things that might be of advantage, you know, in your sons and daughters, and then help I think alleviate a lot of the frustration, because you can't know everything that your sons and daughters may think of that they want to know, you know, more about or want to pursue. And you know, if they want to pursue something, it can be pretty intense, right? I really want to pursue that. I want to pursue it to its nth degree, you know, whatever it might be. You know, and behavioral support, I have some questions about that, because, you know, there's a lot of folks that, you know, in my view, put on a pretty good show, and that's okay. And I know even adults that work on behalf of people with disabilities, some of them don't get enough attention. I don't know how. I mean, I'd like to have a whole lot less attention myself, certainly, but some people want more, I guess. But we actually designed the behavioral supports to allow a lot more people to be able to provide supports and services. Bonnie, you want to explain a little bit about behavioral support, how it's supposed to work,
Sure.
the waivers?
We, right or wrong, we tried to broaden what licensed professional services people get in a waiver. So we combined several licensed professionals into consultative, clinical, and therapeutic services. That includes positive behavior specialists, psychologists, counselors, dietitians, nutritionists. And so within that one service, any one of those licensed professionals can provide supports.
So some folks, I think, maybe have been offended by saying, well, you're paying them as much as you're paying us, kind of thing.
The different licensed professionals don't feel like they should be lumped together.
Yeah, yeah.
In that, while you're on that, as you look at that, because when I was reading that, I mean, it sounds like it's a good plan. But I would like, is there a possibility of including, since there's going to be an increased focus on physical activity and wellness, to also under that umbrella of looking at like an exercise physiologist, or, you know, people that have public health, exercise therapy,
or like a dietitian.
Dietitian, you know, under that kind of umbrella, because as I was at the hearing on Friday, I'm beginning to understand a little bit better, you know, kind of what you're looking at on that consultative.
The dietitian is included in there, but we just didn't think of the other.
Yeah. I'm an old exercise physiologist, but and I'm excited about that we're going to have a focus on that. But then as you look at people with, you know, that have different kinds of developmental and physical disabilities, there's a whole body of knowledge, you know, about appropriate, just understanding exercise tolerance and all that kind of stuff. And I thought, gosh, that would be really nice to be able to have that field, for lack of a better way to, because it's not a licensed field like a nutritionist or dietitian is, or a nurse or a social worker, but it's a body of professionals that go to school and get degrees. You know, it's very specific, and I'm not trying to find a job, believe me, but it's, you know, but that's kind of what they look at, is they look at unique responses to exercise when you.
And there could be a way to get some of that type of service through the natural supports training, maybe. Okay. But it would have to be, you know, individualized to the person.
And then anything we that's not there, because, you know, time changes. And, you know, there's been about 2 years since we first began down this road. Then it's something we can consider for the next time, the next renewal, or even an amendment, you know, going forward. And then anything that that makes sense, that can be funded through EPSDT, know that we'll be by your side advocating for that with Medicaid. So just know that you're not going to be alone in these sort of things. Something makes sense for your sons and daughters, and we'll be there. And managed care, the managed care organizations, what's unique about the managed care contract. No, you want to say something?
Well, I don't want to leave out, there's also music therapy, massage
Oh, yeah,
therapy,
sure.
and
Absolutely.
those other
Yeah.
fields or areas of expertise, that many of our hippotherapy or horse therapy, I don't know what the term is, but, that kind of, those are interventions that a lot of families have sought out and have very positive. They're not maybe licensed like a OT or a speech therapist, but there's, I'm kind of going to say it correctly, but there's a coursework and study that, they have to go through in order to get to a certain level of competence.
Well, there's, I mentioned the EPSDT dollar, those dollars for children have been put into the managed care contracts, that, and then the Louisville area will likely come into the managed care piece pretty soon. Well, it already was first, but I mean, it'll come into the new piece. But
is SEL going to be under managed care?
No,
it's not managed.
No. But know that that maybe I guess to the next part. Know that on the mental health also needs of some of the citizens. Have you all seen the DVD that Dr. Brenzel did? Have you seen somebody seen it? Somebody not? You want to see it? You really want to see it? Did you see it?
Doctor who?
Dr. Brenzel, who works with
Oh, yeah.
our
He's
clinical
the one that
staff.
diagnosed my granddaughter.
Yeah.
Brenzel. Alvin Brenzel.
Yeah. So Dr. Brenzel, he's
He's psychiatrist?
yeah.
Child psychiatrist.
Child
A-L-A-N.
Yeah.
VRENZ, yeah.
Yeah.
Okay.
We want to get a copy of that, and
Do you think it's on YouTube?
I don't think it is.
It's on their website,
Oh.
and I
Which
I
one?
sent it
UK's
out- I
website?
sent it out a while ago, but it's Martha Gray, I think, is, her son speaks in it, in one of the little
Yeah.
vignettes, and there's a section that the judges talk about
Yeah,
autism, and then Brenzel talks, and.
Whose website is that?
Very nice.
Which
program.
website though?
It's on the cabinet's website, I'm pretty sure.
So could you?
Yeah, Mel, could you send that again and
Well,
follow
let
up to
me, maybe maybe there's a better link, so maybe if I could connect with you guys and get
Okay.
the right link,
All right.
and we'll send
Yeah.
it out again.
We help with that. But anyway, Dr. Brenzel, talk about it. So here's the person that we've hired to be the highest medical officer in our department. For that, because we run psychiatric hospitals, we run 7 different hospitals, with psychiatric and developmental disability hospitals and all kinds of services. So we have a child psychiatrist is who we chose to hire, and he certainly works with many children that have autism. So because of all that, then it means that autism is also considered. And there's the whole movement to more medicalize it. I don't want to understate what it really is, but just know that where we are, or at least where I am, is I'm fine with all that. I don't want it to be, didn't Kentucky pass a law for insurance companies? Isn't that right? We have one of those laws, right?
Right.
So that's fine, and it's fine wherever people may need services. I just don't want services to be only medical. Or only seen that way. It needs to be all the developmental sort of services, supports also. And then employment, and some of you know that from me talking before that, Michael was the last person I worked with who had autism. He said he had a 19 IQ, it's bizarre. But anyway, Michael, who rocked back and forth all the time, 26 years old, but I worked with him for 7 hours, and he got permanently employed. I don't know if the rest of his life, but certainly for the next 8 years, I didn't follow him. And so, my skill level working with children and adults with autism is pretty high. And so, just know that I really favor real employment outcomes for folks, and that there's, and my belief is that when sort of a lot of those things don't happen, it's not about the child or adult. It's more about the professional not knowing what they're doing. But we're going to really push and emphasize that. Kentucky at one time was in top 10 in the employment of people with developmental disabilities, and now we're near the bottom. But what happened there was the payment mechanism, really fell out. They really emphasized day centers for people, period. And so it was just the financing. If you just look at the money side of it, money emphasized, congregating, segregating, separating people, and providing this transportation back and forth. So now we switched that. That's the waiver. That's some of the controversy. We've lowered the rate for the day programs by 11%, and then more than doubled, or did double, the amount to be paid for support employment, and hugely increased by, I don't know, 50 or 70% or something, the amount for community access services and a lot of other services. Still, our day rate is one of the very highest in the nation. But that's some of the stuff that providers are a little upset about. By the way, if you serve 100 people, you run one of those day centers and you serve 100 people, if just about 10 of those folks, there's some part of the week, that's all, that they are able to work in a job or are able to get in a club, group, association, church, someplace where they're connected with other citizens that have similar interests that they have, not needs, similar interests they have, then that day center will make more money than they did. They keep 90% right there in that building and don't ever let them leave, but say, okay, you 90% are going to stay right here, but I'm going to let 10 of you have a real life in the community at least part of the week. Then they actually make more money. So the notion that we're cutting their money is ludicrous, because if they do what they should, which is move about 25% of the folks immediately the first year, just to ask people, what would you like to do? Just simple. Would you like to leave here? Yes. Would you like to go someplace? Yes. Would you like to become a this club or group association? Yes, yes, yes. Would you like us to provide supports on evenings and weekends? Yes, yes, yes. If they just do that, then they will make significantly more money. If you just look at the money side, make significantly more money as a day center just by simply expanding a little bit into something that they're not so comfortable with. And that's the whole point. People say limiting choices. All we've done is add choices. And if mom and dad's saying, I hear what you're saying, but I don't want to, it's too scary, and no, and I got enough dealing with right now, because sometimes this is the case, and I want them to stay right where they are now, then that's okay too, absolutely okay. So no choices are going away. Not a single choice is going away. So every choice is staying. So yeah, and what upset us a little bit, Tony and I, is we met with all that provider association, for weeks, and then for just the hours, was it hours, same day they did that? No, the day before, right? When Kathy and I went over there, when I met with the whole provider association. Met with them, explained the things I'm explaining to you now, showed them the documents about how the waivers were written and what it actually said, showed them that the fears that they were telling families, you shouldn't be telling them, because that would be, because you can't use the word lie. Let's see, what is it? My wife told me, don't say lie, don't call people liars, that's offensive. Let's see, not deceiving, that's almost worse. But it's different than they thought the truth was, I'll say that. Anyway, and so here it is. Do you understand? Yes. Everybody understands? Yes. You are all at the 144 commission. That's some of the people in the room, key people, yes. You're part of the vote that everybody said yes, understood it. And then we left the room, and then they started saying it again, and there were key people there. I said, what are you all doing? The commissioner was just here. He explained it. He showed you the documents on this. Why are you still saying these things? Well, we just feel like we need to say it because we've been saying it, and families are kind of counting on us to, really, I thought they were counting on you to be truthful and honest and give the right information. And so when one of the people got up to present at the hearing, they actually said, well, we did talk with the state, and they said that they are working on this, and that probably most things I'm going to say are being corrected. Wait, no, they're already corrected. They're already done. So I thought that was kind of disingenuous, but anyway, so then you end up with the reporters writing these kind of things, which.
Oh
no, I didn't read the article.
So, but anyway, I'm a little tougher than I, and I just asked. So tell me, what if the definition? Tell me what might be a greater definition of evil.
Yeah.
If it isn't saying to a 70, 80, or 90-year-old mom or dad that are nearing the end of their life, and they have a child with a significant disability, and you're scaring them.
Yeah.
Tell me what is meaner, more evil than that. And that is exactly, I looked right at one of these people's face who was doing it. I said, I'm just telling you what I think. You know, I'm just telling you what I think about what you're doing.
Now, was this at the meeting in Frankfurt last week?
And of course, I just can't say it in public like that. I'm always going to be nice in public. In Frankfurt, yeah,
But
yeah,
you know,
it
what,
was.
what
At the
you're
hearing.
describing is a lot of work. You know, it's not a lot of work to keep somebody in a room, you know, and throw some games at them or whatever they do in day centers. But what you're talking about is somebody that's going to have some creativity, some work ethic, somebody who's a go-getter, somebody who's willing to get out there and mix it up with the
Yeah.
community, who's willing to take a risk with people who may not, you know, corral up so well, you know, herd up so well out in the community
Yeah.
and all that. And it's a lot of work, and it's so much simpler to sit in a room and do nothing.
Yeah, I agree with you, and what Claudia agrees with you, is that I just feel like if you're going to be in human services, and now it's not like we don't know what we're doing now. We actually know what to do. There's plenty of books on that table right there. It says a lot of things. This is what you should do. Here is what you should do. It shouldn't be like, wait a minute, we're spending billions of dollars. I mean, the research that I just read today said if the people who have developmental disabilities, who want to work in the community instead of work in the workshop, if they were working in the community and had the kind of skills that the people, like the are in sub-state, like the state of Washington, for example, that has by far the most per capita people working in real jobs in the community. If they were doing what the state of Washington would be, the amount of taxpayer savings, not just talking about all the benefits of people with disabilities, the amount of money saved taxpayers is $1.5 billion.
Is that in our state, just in our state?
Huh?
Just in Kentucky?
No, it's in the nation, in the nation. So what it says is that whether you love or care about the folks that we love and care about so much, if you just, you know, as I told some other folks, if you just think about money and you care about money and you're hungry for money or whatever that is, I know some people are like that, it's okay. If you're like that, you only think about the money perspective, this is something you want to do. You want to support these waivers because what they do is they say that these people are worth something, worth investing in, can be taught things, and they need to be around people that know what they're doing.
Well, yeah, that's the other thing I want to talk about a little bit or spend some time on is training. Because it seems to me, and I just barely skirted because I don't get a lot of service. In fact, I get none, really. But anyway, I am doing some voc rehab, and we have all kind of discussed this to older parents that there's not often good fits with our kids, and there's not understanding in the community on what they need. And, you know, for example, I like this gal I'm working with, but, you know, her first response when I had some concerns was, just stick it out. This gal's good. Well, she might be good, but my child is not clicking with her.
Mm-hmm.
And the first and foremost thing for anyone, typical or atypical or whatever, is if they don't click, they're not clicking. You
Right,
know,
exactly.
and the things that probably were positive about this gal, the job coach, is that she's kind of assertive and aggressive. And that's okay if you're assertive and aggressive. If you tend to be kind of a withdrawn person who doesn't communicate well and has difficulty saying, push back, you know what I'm saying? That's not a good fit for a kid with Asperger's who can't really, who feels run across and run down, and he can't really push back on this gal.
Right.
Now, mom can push back pretty good, but he can't. And she's coaching him, not mom, you know. So my whole point is that now it's just dead in the water, you know. I didn't go with the first advice or whatever. I put up my complaint. I made my case. She sees it. Now we're dead in the water, and it's kind of gone nowhere. So it's going to be interesting to see, A, how long does it take to get a new job coach? B, is it going to be any better? C, is she telling me that this gal's good because maybe she is the best there is?
Well,
you know, so I don't really quite know where we're at on all this.
Let me share you with this happened, because what often happens is that when we begin discussing, you know, things that the new waivers will allow, then what comes up is a conversation like we're having now, which is, that all sounds well and good, but do we really have the people out there that have the skills to be able to deliver on this? And let me show you how you get that. Is that what we were able to do, and what Claudia's working on right now with Medicaid, is developing a single fiscal intermediary, or what's the term now, fiscal
Management agency.
a fiscal management agency. What that does is allows the fiscal management agency will hold the Medicaid number. Here's the problem that we have now without that operating like that. It means that as long as you work for one of these companies that has the Medicaid number, then you're able to bill. But if you don't work for one of those companies, then you can't bill, okay? So what happens is, if you're making sandwiches and you're really good at it, and you decide, oh, well, I think I'll go to someplace else besides McDonald's to make sandwiches, and you go to a better place that makes sandwiches, and you know, okay, well, I'm gonna go to a hotel or something to make sandwiches for them, and at some point you're so good at it, you say, I'm gonna start my own business, then you start it. And that's how the whole nation works, that's how the whole society works, is that you have the opportunity to learn skills and then move on, except for human services. In human services, you want to move on and finally become, okay, I want to go into my own business. Oh, sorry, you don't have the Medicaid number, and we only hand them out so to many people. Mm-hmm. What breaks that whole monopoly up is something called a fiscal intermediary. What it does is allow somebody who's going to work with 1, 2, or 3 people to be able to do that work and then be able to bill through the fiscal intermediary who has a Medicaid number. I won't say that it's going to happen here, but it might happen here, since it's happened everywhere else in the nation that this happened. And that is that, for example, in Colorado Springs, when I went there, worked there for 10 years in that community, went there, we had 14, parents had 14 different choices. Most parents would love having that many choices. Had 14 different choices. And when I left there, there was over 260 choices of providers because of what I'm talking about now. Because we had a mechanism to allow people to be more entrepreneurial and to develop their own businesses and their own expertise in different areas. So that's how you do that. And also this notion that, oh, they won't come to Kentucky. That sounds good for Colorado Springs. Everybody likes to live there. But they won't come to Kentucky is also a myth, because remember, these rates we've dramatically changed to emphasize and to promote the kind of very services we want. So that we've got those rates up high enough that they can hire people that are going to make a living, you know, providing supports and services for that, and are not always going to be looking to go someplace else. Staff turnover in that community, now we did things, I mean, really, really, really right, and brought in the best and the brightest in the nation to teach us how to do right. But for one long stretch of about 7 years, we had less than 3% staff turnover, while the rest of the country, families, are suffering through 35 to 45% staff turnover every year, which means you lose somebody basically every year or every other year, or sometimes 4 or 5 times even a year, because we know that's a disaster. So it's about funding people in a way that they can make a living doing this type of work, and this is what they want to do for things. So that's the way it is.
I have a question about that. I have 2 workers, one has a degree, one of them doesn't. They both do excellent jobs.
Yeah.
I know you're going toward more degree, that the direct staff have to have college degrees. I'm concerned about how my current worker, who's been with my son for 7 years, no turnover, he's real happy, does a good job. I want someone like him to get into this field. Now, I will get the experience. I know experience can substitute for college education. But how would you get that experience? You got the experience because you got hired directly in the support.
Well, you're right. You know, what we're trying to do is to certainly be sure that people, we believe our citizens with developmental disabilities are as good as anybody else has developmental disabilities in any other state. So we want them not always to be just working with people who don't know what they're doing, who are learning off of them. So we're obviously trying to upgrade the supports and services. I'm not certain how people would get the experience, but I just know that we're going to grandfather people who don't have degrees to do some of these things. Or what's the right word?
It's a substitute. You can substitute experience for a degree.
Okay.
But it's only 2 services that's changing. It's community access and support employment that require a degree.
So the other
Is community access part of what's now CLS?
So
I have concerns
CLS
about that because I tend to hire college students, which is its own problem because I have to, you know, schedules change, they graduate. But I like, my son is a 19, almost 20-year-old. I like him to be with people his age and stuff. So how would you address that?
Well, just the community access requires a degree. The other half of CLS, the personal assistance, does not require a degree. And we're also doing,
So they do personal assistance.
right, so they
Is
can
that
do
similar to
another,
respite then?
it's similar.
Is it in the home,
Yeah.
personal
They're doing that.
assistance?
Yeah, it's personal assistance, and it's like CLS in the home.
But they couldn't take them out to like
couldn't.
soccer practice or swimming?
They could take them to those under personal assistance.
Yeah.
But they don't make as much money, is that
That's
right?
right.
Well, community access is not just to take somebody to practice, it's more to get somebody connected with natural supports in the community. But back to the degree, we're also coming up with a credentialing program, so if somebody doesn't have a degree, they can instead get credentialed for the different services.
Through training?
Through training.
And community access, the rate's $32 an hour, so it's not like we're playing around here.
Mm-hmm.
We're really, really putting out the dollars necessary to have high-quality people that know what they're doing, getting these things done, who are gonna own homes in your neighborhood and do that. So
Is that what you're
Just
saying,
an
an hour?
what's that?
Is that what you're saying, you're paying, somebody's being paid $32 an hour to be a community?
That's the
support?
rate.
That's the
too.
rate.
That's what the provider
That's
can
what
do.
provider is. But what I'm trying to get across to you about those rates, about that is that the days of just being able to take just anybody to provide services are probably gonna be pretty well over. We know that when you have real high-quality people that know what they're doing, that have college degrees and are really smart, that those people tend to get that job done far quicker, do it
Yeah.
right, do things how they should, and then so many more people are successful, because that's what's happened
But-
in some other states.
But
Yes.
how much is the agency allowed to skim, and how much is actually going to the person who's gonna work directly
Well-
with the client?
Well, that gets into how that funding mechanism works and how, all the details about financing and that sort of thing. But know that it takes a lot of dollars to be able to provide insurance, health insurance,
Yeah.
training, background, and all that for the employees. So when you ask anybody who has an employer, how much is it that will have to pay and all that, then it's substantially more than the 5% or 10% that the general public thinks it is. So they would be able to take quite a bit of that, but still it does say that the person working in the field of doing this work would be able to make a living wage and be paid comparable to probably like a school teacher would be paid.
So are those companies then audited by the
Yeah.
state? That's what I'd like to know, because if we're told that our CLS person can only receive this much per hour, I would sure like to know then what the people at the office are skimming off the top. As a taxpayer, I would like to know how
Sure.
that money's being
Yeah.
spent.
We're just now implementing the waivers, and, obviously, I've been doing this quite a few years. That question and how we do all that comes just a little bit later about how to do all that and how to get that done right and how to be sure people are doing it. There's things that we're building into the waiver and into the funding allocation that takes care of that, but again, it'll take a longer conversation. I had a long conversation with somebody in the previous Clinton administration where a group of people worked on something for about 7 years that we were able to figure out that they could not after 7 years work, and these were some of the best and the brightest. So know that this is a whole, I've done national presentations before all other 50 states, directors on what your question you're asking is how you fund these mechanisms and that. But so we're doing that, and we're going to have at some point individual allocations based on need, so that you'll know that your son and daughter will be getting the exact amount of money that is fair relative to other Kentuckians. So you won't have to say, well, it's who that person knows is how much money they get, or who they gets that much money. Services are, you know the truth, right? I mean, the truth is that 80% of all services in the United States for people with developmental disabilities are being delivered by moms.
I believe
But-
that. Yeah, I believe that
But you
too.
see,
Yeah,
if you don't have an outside agency, then how's the parent supposed to know who is gonna be a good provider? You see what I mean? You want some sort of
Well, yeah.
objective information rather than calling your friend down the street or another parent. Another parent is a great resource, don't get me wrong. I mean, in this group, that's who
Sure.
I would go to, but it would be nice to have somebody that's just watching the ship, so to speak. And then also, again, make sure that the people that are providing the direct care are getting a decent wage, and they're not just making a bunch of money in administrative costs. yes, they have to pay insurance, yes, they have to run their business, I understand all that.
Right.
But sometimes they're keeping quite a bit in-house
They are
and they're
now.
not putting it out there
Come on.
to the people who are really working in the trenches.
And they are. I want you to know that what mostly is going on, though, is they are being underpaid for some people and overpaid for others, and they're actually taking them, most of them are good people, and they're taking their dollars, and for the people that they are getting overpaid for, they're actually using those dollars to help people that they're getting underpaid for. But we would like to keep that so that everybody got what dollars that they need. But I want to tell you a little bit about something else you brought up, which was about how will parents know who's good and who's not. Mm-hmm. And we're developing, we don't like to do it this way because, it's much deeper our culture. But we're developing a report card type of system so that families will know about how people are doing based on their performance in working with other people that have disabilities. So you will be able to know what's going on, health, safety, well-being. We're putting in a case management system and training. That is not bragging, just what happened. As some of you know, I worked in Georgia for 5 years. What I told folks is that, I'm sorry for this being videotaped, but anyway, I saw hell and couldn't resist. I was in Colorado, things were going great. So many people had died coming out of institutions in Colorado, and I've been doing consulting for them that I felt compelled that I had to go there, and so we did. And we took them from 50th in the nation on the question of, do you feel safe in your home, to first in the nation. Wow. So today, people with developmental disability in Colorado, when asked the question, do you feel safe in your home, wherever it may be, with family members or living in group homes or wherever they may live, the answer is far positive than in any other nation. So no, we built all that into the waiver also, all those type of safeguards. And a key part of that is informing families. And a key part of that also, when we get to some of the details, is actually including families in something that's going on. It's pretty cool from a mom's perspective compared to human services perspective. When moms go into a house to determine whether it is good or not, they go right in and open that refrigerator and just say, okay, what's in here? What are you feeding my baby? And if they, and I don't mean to put down Costco, but look, people with developmental disabilities should not, after they leave their mom and dad's house, should not have every single thing that they ever eat come from the big Sam's Club or Costco. Come on, everything isn't bought in bulk. There's tremendous data that show that people with significant developmental disabilities are not being fed healthy diets. It is a big deal of the 144 Commission now. What's the subcommittee called, Claudia? Health and Wellness. We think that people with developmental disabilities are dying too soon. We think people with mental health needs are dying too soon, and we think a lot of the reasons why they're dying, the data is showing us that they're dying the same things we're dying of, which is, heart disease. So we are going to do things that people are going to say, you're taking away choice, you're being mean, and who are you to say what I eat or drink and what I do with my body and all that stuff. Well, we just know as taxpayers that it makes sense when people are eating better and that. So just know that that's the kind of stuff that we're going to be pushing and giving you information about how people are being treated and what's going on there.
I had a question related to what you're talking about. Sure. In terms of your rating system for agencies. And I wanted to know, are you going to have a customer, like a consumer satisfaction component in that? Because, for example, my daughter, we've used 3 different agencies now at this point, and 2 of them were, I would not recommend them to anyone. So, and then kind of like what Karen said, if the only way I get to do that is if Karen comes up to me and says, which agencies do you think are good? I would say, well, stay away from these 2. They were terrible.
Well, we absolutely will have. So yes, but know this. We're going to have the sports intensity scale where everybody's getting an assessment every year. So after all the smoke's cleared and everybody's stated their opinion, we're going to use real objective data to look at how is this person, this is what you said you would do with taxpayer dollars to benefit this citizen with significant needs. What happened during that year, and did you succeed or not? And there could be a whole host of reasons why that they did not succeed as to what they intended. That's all. That's fine. But on the balance of the citizens you serve, how did you do as compared with other organizations that do similar work? And that will help inform us about how people would be rated or thought about that. As you might guess, as a provider of service, I mean, they are going to absolutely or likely not be so much in favor of this. But here's what I've always said. When I was in that place running as a provider of services, is that bring on whatever those rules are and everything, and I will play by those. And what happened in the organizations that I ran, I was overwhelmed by the number of people that wanted to get services and supports in the organizations I worked, because I did the things we're talking about. Hired the best and the brightest, had people loved working there. We only paid in the middle of the road, by the way, as compared to other organizations. But it was a place where everybody knew that the only thing that I, as executive director, cared about was people with disabilities, that I cared about them. But they also knew that I knew every one of the staff members' husbands' names, I knew their children's names, I knew their wives' names, I knew their family, and people would be so surprised about that because I wanted them to know that I thought about them as human beings. And so it mattered, so that I didn't want anybody to miss their kids' soccer games, anybody to miss their school appointments, all that. So when you treat people like that, when you really treat your staff as real human beings, and of course we brought in the best and the brightest to train these staff. We brought in Mike Callahan and I can't remember what the other person's name that we brought in.
Michael Small.
Yeah, Michael Small, and we brought in really the sharpest people that there are, the people that inform CMS and other folks, to train the staff directly. Michael Callahan, folks like that. Kerry Griffin, David Hammis, people like that. And then that made a difference, yes.
So there will be a measure also to measure those subjective things like learning, like this guy was really nice, he knows all my family, we have him over for dinner, things like that, other than the scale. Because it seems like the scale that of assessing people once a year would not measure those things.
Well, it wouldn't. But so that's why I think what she's talking about, it needs to be about what the person's, opinions are. What was it? My daughter just wrote me, she's in graduate school at the University of Delaware. And although this professor is just knockout, brilliant, Yale taught, smart, wonderful, she's just terrible. She's humiliating to the students. So what she writes back to students, she is just as mean and humiliating to them as can be. So it's that kind of stuff. It's like, yeah, you're no question about it. She is a great teacher of the skills. Along the way, though, it makes it so that you want to do anything else but, do whatever the subject is. So that's a part of it. Absolutely. Yes.
Can you address how this is going to affect, in particular, people that choose to consumer direct? We do consumer directed option for some of our services, and I know like can you address this community guide thing? And I think we're going to be able to get a case manager, training,
both,
et cetera. That's annual assessment thing. How's that going to work?
Sure. Well, although we're talking right now about the SCL waiver, but we're about ready to take over also the Michelle P waiver. And as you might guess, the Michelle P waiver is going to look exactly like this, except without the residential component. With that said, then people would, as you might guess, have the amount of resources necessary with their need relative to other Kentuckians that have similar needs. So that's code for saying that probably some people are getting inordinate number of resources well beyond what their son and daughter's maybe significant disability would be, while other family members are getting far less resources than they need to have. That's what we already know. Claudia and I have looked at some of the things. We already know that's what it looks like. But you cannot suddenly say, okay, we know what justice is. We know this family should get far less, this family should get far more, and it's what we're going to do. So we're going to phase that in over a period of about 5 years, that adjustment in service, so that you end up, when we look down the road, back, or down the road, I guess, 5 years from now, we'll see that people then are getting the amount of money that they should get relative to other folks. Then with those dollars, all the things that are in the waiver, you're going to have the freedom then to buy and purchase. Now, there's a few things that maybe aren't right. Residential services are not self-directed, that money, right? That you can't. But the other services, maybe there's one or two that aren't.
Medical services.
Medical services you can. But all the things we generally talk about in services will be able to be self-directed. But with that said, you know, people are going to have to perform. Well, I really like her. Because see, there's real charming people that are really just nice. And they find, oh, I love your daughter. Oh, she's so sweet. Oh, I'm there. And he shows up on the birthday. He does all those little fun things and all that. That's all. I'm sorry, but I really, as a taxpayer, got to have people that know what they're doing to really deliver and not just be sweet and funny and cute and all that. I'd almost take somebody that's kind of grouchy that actually knows what they're doing, you know, to help people. So no, we're going to have some pushback there sometimes. One mom screamed at me because I wouldn't let her hire a person that was a second-degree murder, convicted. Yeah. She says, no, I've met her, she's nice, you can't tell me, this is self-directed and I can do what I want to.
Well, I'm not really talking about that so much.
You don't
I'm
want
not
one
talking
of
about who we can hire, although I appreciate your
What part
input.
about it you concerned about?
Well, like training, for example. Like right now, if I want to train somebody, I can't use any of my budget to do it. Whereas I guess if you're an agency, then they're going to provide training.
It gets into some of those details we need to probably discuss a little further down the road. But,
Okay.
but if you heard what we talked about right off the get-go was about that, what's it called again?
National support training.
Because we called it something else. We called it something else in another state. I can't ever get it.
I'm really glad you're sitting there.
Oh yeah, so yeah, that I can see that.
You see?
Okay.
This is funny.
But here's the
You
tricky
guys
about
remind
it.
me of like a work married couple.
What is that, Claudia?
Question about, this is not exactly about the waiver, but I would like for you to, do you want to finish the question?
Yes, sir.
Well,
Maybe that'll help, that natural support.
okay, I see that.
Yeah,
Okay, what
one more
about, I keep hearing about this community guide, that it's
Right.
gonna be, is that just for the CDO
Yes.
Yes.
people? Okay.
And what a community guide in most places is called a support broker. Support broker. And so if you look at the literature.
That's what we have now, is support
It's
broker.
support broker. So a community guide is mostly another name for that. But what that person needs to be an expert at is knowing what all the community resources are. So when you say my son or daughter is interested in this, then that's the person that is paid to go out there and do that. Here's what's unique about how we're doing the community guide. The only person they can work for is you and the person with the developmental disability. They can't be, they are a person that is absolutely 100% conflict free, cannot work for anybody else to do that work. So that
Agency, you mean?
right, well, they could, unless they, an agency of just community guides could be formed, and that's what happened in Colorado. But just know that community guide is a person that is, you know, there's no conflict of interest because the money's all coming directly right out of that plan, you know, for you. And I highly recommend every single person. Of course, you know, I wrote the first 100% self-directed waiver in the nation down in Georgia. So you have some idea that I'm heavily biased towards self-direction, and then if I could, but the law won't allow me, I'd insist that everybody have a community guide, because then you got a person that's absolutely working for you on your child's behalf to find all the resources necessary to do whatever you need to make this plan. So that the ideal plan is not made up of just one provider, but it's made up of 2 providers or 3 providers or 4 providers or 6 providers or whatever. You're able to choose whatever might be best for the given situation. Even the person doing it might work for multiple providers, or sometimes would or wouldn't. There's just all kinds of combinations there to make
And
that
that
work.
person has to have an undergraduate degree, of course, right?
Or the community guide, yeah.
And so these people are self-employed?
It could be either self-employed
Or form an organization?
or form an organization. There'll be somebody who'll be smart enough to figure out, hey, I think I'm gonna hire a bunch of community guides.
It seems like it would be something hard to start. You'd have to like quit your job and get enough clients not to starve.
Yeah, it's like Jennifer Briggs, down in Georgia did that. I mean, exactly, she said, okay. And she
Once it got going.
talked her husband into it, and he goes, okay, honey, what's this gonna actually work out financially?
Can you work for like Home Depot and do this?
Oh, yeah.
You just can't
Yeah.
work for like another mental health agency
Exactly.
or something like that.
Exactly.
Okay.
And everyone will have a case manager. The way the waivers are now, if you self-direct, you get a support broker instead of a case manager.
Right.
Which is
Now,
right.
everybody, and we didn't know that back when this all started, and so now everybody will have a
Oh,
case manager and can
that's
hire a
great.
community guy.
Yeah.
Where does the money come from to pay the community guide?
comes out of the person's plan, whatever their individual
Out of the
budget
budget.
piece are.
Oh, you're in.
Yeah, that's why people say, oh, no, I think I'll do it myself. You know, and you can do that if you want to, but.
We don't want to, we're
Yeah,
So,
but you know what I think is that, I mean, yeah, it's just like, we want it so that moms and dads can be moms and dads,
Yeah.
and parents can be parents, you know, and that you not have to spend your life becoming all the expert. I mean, think about how much you all know. You know, you've come up against teachers that don't have nearly the knowledge that you have, and that. I mean, I know, but I'm gonna get to my own situation, but just, you know, I know that when my own daughter had some significant issues, I mean, I was studying everything to be studied, doing everything I needed to do, and all that, and then, you know, was working with the medical personnel, you know, hand in glove, knowing that, you know, so it's like, you know, when you're a parent and you have any type of background in well, never mind. But anyway, you know what you do. It's your kid, so you just go wild in learning everything you can possibly learn about what that is. You know.
So you said each person will have a budget, is that gonna be, the money that you get will be based on, like,
Needs.
some testing that they
Needs.
do on the child, on what the needs are?
Be based on what the third,
Is it
eighth, and ninth
objective testing,
what the
or-
third, eighth, and ninth federal court said it was based on. It's based on what the person's needs are relative to other people who have similar needs.
Well, who
Who's using
determines what the needs are?
The test and what you.
Is it assessment?
Yeah,
Is
supports
this,
intensity
is this
scale.
like what
Is it
Access comes in
written?
and does?
Yeah.
Is it like a multiple choice written thing, the
No,
parent
no,
fills it out,
no,
the
no.
kid does it, or what?
That's a
What's
whole,
the evaluation?
and you're welcome to look up supports intensity scale. You look up the internet and you can see what's coming with that. Already, how many people have taken it so far?
Almost everyone in SCL, I think
28.
2,100 maybe,
Yeah,
so.
2,100 folks have
half, I
taken it
guess.
already.
Can I go ahead and say what I was gonna say before that? Let me go back to
Oh, yeah,
this.
sorry.
Okay. This is totally off subject. There are people in this room who have supports for community living, whose individuals live at home with them.
Sure, yeah.
When the worker that they've hired is ill or whatever, the agencies do not provide people to back them up. So the parents have to take off work or have to do whatever it takes to fill in. My understanding is like on CDO, there has to be a backup plan where if this worker's not here, who do you have that is the backup person who's gonna come in? But there is no such thing. You have an agency that's providing it.
So that's
There
some.
should be.
And they have something like that for, if it's a
Yeah.
group home, they have to. If
They
it's-
should be.
But for the ones who have people who live in their homes, there is no backup.
Well,
And that's something the team needs to talk
Yeah,
about when they meet.
and we'll get
Make
that
sure
trained.
That's part of the.
You know, I used to say
process.
about employment specialists, you know, people who are getting people jobs in the community, is that they must always come in at least twos. You never do one, because there's such thing as called a vacation. There's things called the flu. There's all kinds of things that happen. There's things called child getting sick. All kinds of things happen. That means at some point the person cannot be there that day or that time or whatever. Yet some of these citizens, it's really critical that you have, well, with like something called errorless learning, where you make sure that things happen the way it should happen. So you always have to do cross-training in that backup. That's part of just running really good support employment or community access services.
Okay, so they don't have that. They say they can go to the day program and sit in the day program, which is not a person's plan.
But-
So what do you do if they don't, they just say, we don't have anybody?
So
We don't have that.
you should know this, that since Claudia and Alice and I have worked here, we are really kind and nice and good people. But we've also probably put more providers out of business than any other time in the history of the state. And that is because, and successfully, and not a single appeal has ever been won by any one of those providers. And the reason why.
Wait, could you say that again?
What's that?
I didn't hear what you said, because there's.
I said that there has never been an appeal that has been won by any of those providers who appealed our decision. So know that a part of providing good supports and services is not just getting people who provide the good supports and services, but it's also about ensuring that the people who are providing it, those who don't do such a good job, are also no longer providing.
So you actually have a complaint department where if we as families are not satisfied with whatever's going down with this agency, you can file a complaint with your
Yes.
department and you guys will look into
Yeah,
it.
grievance
Absolutely.
process.
Is there ASBG?
What's that?
Is there ASBG?
There
Keep
is.
it going, yeah.
Mhm.
But you can also call our office directly, and we have a staff that takes complaints and assigns those for follow-up. But you can also call the state ombudsman.
I have a question about, you know, when you talk about SCL, like my granddaughter's been on the waiting list for like 11 years.
Sure.
And she is receiving Michelle P. services, but when you talk about like Michelle P. is this and then SCL has the residential component, what if, as a grandmother, I want her to live in the home that she's in, and I know all that has to do with future planning and stuff, but can that residential component be her own home, or does she have to go into a residential home of 2 or 3 or 4 people?
That's something new we put into this waiver. There's a level 2 residential that's allowed in the person's own home. It's a lower rate,
Because
but
that
it
would be
provides
my
services.
goal, is that eventually, she's almost, you know, she's 16, so eventually I would like to see a managing person move into the home, or, you know, something like that.
Another service that's in both of the waivers, SCL and Michelle P, is called shared living. And that's if your daughter or whoever wanted to have somebody live there with her, the waiver would pay for that person's share of room and board.
And that's
in
what I'm
exchange.
talking about. I mean, she lives with me, she doesn't
Right.
live with her mother, and it's just the 2 of us. So my plan would be to phase out into, you know, another something part of my life and have somebody take care
We'll just
of her
know-
living arrangements.
We'll just-
Something in your.
Into your house, in the basement. You never know I was there.
I need some support when I get up there.
We just know that, as the years pass, that part that Claudia's just talking to you about, or that the question you just asked about that support in the home will end up being the piece that family members will just love about these new waivers. Because that's like, I hear all these other things that's really good for the person, but now here's something that really makes this all work. So rather than, because the rules were before, well, you want to totally give them up, are they going to be yours or ours? Which one it is?
Especially a kid
And
with
this blurs
autism, that's just so critical that they can stay in their home.
Right.
Yeah,
I have a question. You brought up this new evaluation.
yeah,
Does
sure.
that mean like every year
Yeah.
we're gonna have to be reevaluated?
Don't be worried
Child?
about it. It's a sports, no, don't worry, don't worry.
Or we got kicked out in
Look,
Georgia.
know this.
My autistic
this.
son got kicked out when we lived in Georgia.
Know this, that the supports intensity scale is the only assessment I've ever endorsed in my entire life. I don't like assessments. I think they really try to find out what's wrong with the person. What the supports intensity scale does is it finds out what are the support needs and how much of the support needs and how strong the support needs need to be. So no, that's what it's about. It's something that you'll want to do because you'll know it makes sense. The first year is going to be a hassle. It's going to take about an hour and a half, hour and 45 minutes to do. As years go by in implementing it, it comes down to about 45 minutes. But, and of course, Claudia or anybody else, but nobody wants to do it every year. I'm insisting it happen every year because I want to know the performance of those providers with the taxpayer dollars so that I can go to the legislature and say, listen, we have a waiting list of how's the waiting list on SCO? 2,300 people. Here's the performance of the providers, and here's what they're doing with folks, and here's how many dollars in taxpayer savings has happened because now they know what they're doing and they're doing these things. We provide this training. So here's real savings to taxpayers. Guess what we want to do with that money? Serve other people. And so that way we can begin serving more and more folks.
And you have an assessment now every year. It's required by.
But it isn't as good.
Government, you have to have some type of an assessment every year. But this assessment.
This will
is
just
really-
replace that one.
Yes.
Right.
and this-
Yeah, but it's
this
not going to be a
assessment-
humiliating type assessment.
This
A lot
one
of
will
those
help,
assessments.
help the team develop a good plan.
If I was a family member, I wouldn't tolerate some of that stuff. Well, I guess you have to.
But the first year, it may take more like 3 hours for the first assessment, and then it gets easier as you go.
Yes.
Some of the ladies know, and I haven't been here for a while, but I've got a situation. I think you remember me. Our grandson is 13. He's been a No Lady of Peace almost. It's over a year now. And we decided after they done everything they could, because he got so severe when the wall head, we couldn't let him get hurt. So we finally made up our mind in March with the hospital to do academy. Okay, we had Coventry. They approved in March for him to go to National Vet Academy in Mount North Woodbury. He had 4 or 5 places. And the Our Lady of Peace and some staff down there.
Is that Florida?
Florida, yes,
Yeah,
about
yeah,
North Florida.
right.
Some staff down there because they had other autistic children along with my grandson to see where he was some better fit. Well, National Lip Academy, I found out through the ARC, through our ARC thing, some grandparents had sent a couple of their kids through Our Lady of Peace that I had met through there. And the outcome from the young lady, she's like 14 now. She'd been on Our Lady of Peace for 3 years, had been on 12 medicines. Now she's completely communicating. The turnaround is just phenomenal. Well, Cover T proved it the first time. They didn't have a bed, so they put us on the waiting list. They built a new unit. By the time, in July the 2nd, they called and said, the hospital, and we all had a meeting, the doctor and everybody said that, you know, he'll have to wait till next month, okay? So we waited from March to July, and we was like, okay, we gotta do something, okay? And then in the process, July the 18th, Cover cancels their contract with Our Lady of Peace. You can't, you know. And then, so the hospital goes ahead and keeps him, okay? Well, then, we start for Northern Academy in Northern Illinois, okay? We get everything approved. Our Lady of Peace goes out and buys a plane ticket. Cover Tree. I get a call from the academy in Illinois at 3 o'clock that afternoon. He's supposed to fly out that Monday. Cover Tree denied him. Okay, so he's sitting in the hospital now.
Are they at peace?
Waiting for somebody, okay, 1, 2, 3 for foster parent. Because we're going to do defensive state to try to get him, I mean, and there's no reason for him to go to state other than we can't get nowhere, you know.
Right.
You know what I'm saying? Yeah. And I'm frustrated because we can't bring him home because he's not safe. But we don't have the help. Nobody does. And so, Coverage said if you try every resident so far has denied Tyler, okay? Once he was at foster home, took him 5 minutes on the phone when they told him the truth about him. No, okay? And you calls the parents, says, my physical came and seen me the other day. The social worker, behavioral therapist, the foster mother, whoever she is, said, okay, the husband sent back and saying, does he ever sit down? Does he ever hush? He doesn't talk, he makes noises, he communicates something. And he's having a real kind of funny look, and she said, well, are you ready to take him out? Are you ready to take him home or whatever? And have you been around an autistic child? The gentleman said, no, I've just seen it on TV. Okay, so we don't know if they're going to step and try to take him out. Then they got another family up in Richmond that's supposed to be retarded behavior specialist. It's kind of interesting. What I'm saying is, Coverage said, deny all his exhaustions, then more pay for him to go to the academy in Portland. But I'm telling you what's going to happen here, and I can't, and the hospital can't get Coverage. They finally went ahead and paid the hospital bill, and they finally found out how to agree. Well, so they finally paid the hospital, and when July 18, they finally paid 2 months of what they had denied. You know what I'm saying? You know, well, what I'm saying is that Tyler is not going to do well in a home setting. He's not ready. He needs the academy. He needs more intense behavior, communication, hands-on. We had Michelle P. Waver. We had a behavior specialist. I had some good staff. Dad, I heard him, but after a while, Dad didn't in the home all the time because he couldn't leave home because it takes 2 to take care of him. Dad finally said, no, I don't want to work no more. You know, I can't do it. I can't do it because he was getting, we had ghost sheet. Dad couldn't do the ghost. Nobody could. So.
What we can do is certainly, Connie, be sure to have her name. I know Dr. Brenzel's been.
See, I'm in touch with Dr. Brenzel.
So we didn't talk with him about where we are now. But here's, I want to say this in what you're talking about the managed care corporations. What was brilliant about what happened in Kentucky was that the managed care corporation contracts that were in all other states that we knew of did not include the Department of Behavioral Health, Developmental, and Intellectual Disabilities in the contract. In Kentucky, it did. So what's unique about it, when it comes to the citizens that we care most about, we're right there in the contract, equal to Medicaid in the enforcement of that contract. All other places, it is just Medicaid alone doing that. So what that does is it gives us a real opportunity to be able to provide the supports and services and to get what people want and to hold those folks accountable for that. You should know that all but of any 8-week period of time, only 2 of those weeks are we not meeting with one of those managed care corporations and going through their reports and what they're supposed to do and talking about individual cases, just like you're talking about individual people and what might be happening. So know that we're working through all of those processes with the managed care corporations and helping them, do what they should do.
Do you understand why I'm upset? Because
Sure,
there's no
do.
reason for Tyler to be in custody of state.
Yeah, I
Under
understand
dependency,
completely what
there's
you're
no reason. And they can't. I talked to Dr. Brenzo here about 3 or 4 weeks ago, and he said this is, what little he knew at the time. Of course, things has changed because he doesn't know, and I hadn't, but what I'm getting at is that, coverage, this has been going on a long time, and why can't something happen to where we don't have to do dependency? He still can go to the academy, other than if he gets something that don't work. Because
We'll work through it,
Okay.
we'll work through it, Dr. Brenzo. But know this, as the money was given to the managed care corporation. That's how managed care works. So money is not, the state doesn't have the money now. The money's with the managed care corporation. That's part of what that is. Now, they have a contract that they're to be held accountable for what they do and deliver the services they've been, but just know that that is all a part of that. I mean, I certainly learned a lot working with them. I had written articles about managed care years ago, but they never find those. But anyway, about that, because it's mostly not so positive. But now that we're working with them directly, there are many areas where they're performing very well. There are some areas where they're not performing so well. But let's face what's happened in Kentucky is that we have a lot of children in what's called deep end services in facilities, in places like Our Lady of Peace and other sorts of places like that, more than most other states have. What's not been developed is a significant continuum of care that provides the services so that people can stay in their own neighborhoods and not have to. That's why I talked about cliffs and slopes before. It's like you either make it here, or if you don't make it here with the minimal supports, then you go to very expensive deep end services. And what we're doing is working with the managed care corporations to develop that continuum. We've asked them to develop very unique pilots to do this. And just this week, we have our first pilots coming in from the managed care corporations about some pretty innovative services and different ways they want to do things. So we're very encouraged that will be good for us.
I have already, and I hope I haven't made a mistake there, because I was advised to switch managed cares. And when I did, I talked to behavioral mental health, and they said that they would follow through with whatever he needed.
Yeah, I'm sure you switched to one of the other two. So, yes.
How is the accountability and progress component going to work for families who choose that the option to keep the children in the home? Because I know that the managed care, it has a lot to do with progress, showing progress or payment.
Yeah.
Is that going to be more relaxed for homes?
Not at all.
So how, say you've got a child who I don't have a lot of experience with autism, that's fine, with schizophrenia, but I've got some people that, all their medication, this is as good as they're going to get. So it can be difficult at times to show progress. How are parents who don't have master's degrees gonna, is it gonna be easy for them to be able to work with the managed care companies to show that this is working well and that my child is making progress?
Self-direction just means that parents get to self-direct their services. The requirements that they have required from the beginning, the federal government has required, that have not been as followed as closely as they should be, I'll say it that way, is that the people who work on behalf of these children or adults need to have the skills to do it. So because you love them more than anybody else does, okay, no question about it. And because you know children, your own children, better than any professional will ever know them. We all know that already. But that does not mean that you have the skill set that can actually help improve them. And that's the part where we're going to need some support of family members, because we're going to have a lot of pushback on that, particularly for family members who have made a decision. I think that I know what I need to know. Thank you for this large sum of money. We really appreciate getting it. And you see where we're up against? We're up against some pretty tough times coming up. But what we're going to do is we're going to ensure, as long as the folks, sons and daughters, are progressing and doing well, then they can self-direct and it'll be fine. But if not, if families are receiving money in self-direction, if that money is not moving to people who really can help improve their son and daughter's life, then as a taxpayer, we want to be sure that that has changed. So we'll be working through.
So is there going to be like another level of paperwork, or as far as how do you tell if someone's making progress?
But sports intensity scale, I said that.
Just through the yearly thing?
And then
you'll have to set goals or something? I mean,
You should be doing that.
right.
Yeah.
Setting goals about what should happen, but then,
like through the map, you're talking about like the map.
but those goals will be pretty aggressive. I mean, again, it's about.
And will the case managers for the CDO, family use primarily CDO, will the case managers be involved in this assessment, or?
Yeah. What we're really trying to do with these waivers is get it to be more of a team process, a person-centered team process. Right now, I talk to people who don't even know what that means, that they have a team. Instead of just a support broker sitting down with the family and developing a plan, it should be a team of people.
The key to making this whole thing work is conflict-free case management. It is the poster child of those people who do not want the system to change. That is the poster child of what they have to stop. Because once you have conflict-free case management, once you have a person that is not being paid by the same people that are actually giving the actual services, then you have somebody that can look at it objectively. None of us would ever eat in a restaurant that the restaurant says, you know what, we think we're so good, and look at our reputation. We're so good that we just kicked out the Board of Health. We don't need anybody inspecting our food anymore because we're so good, right? Look at our reputation. Everybody loves eating here. It's the best place in Lexington. So here it is. We just don't have Board of Health. How many are going to go to that restaurant? No Board of Health inspection. How many of us are going to put our children in a daycare center that says, nope, we don't need any of that kind of stuff. We don't need anybody looking over our daycare center because we think we're so good that we don't need it. That's what's happened. Where we take care of ourselves. Or who is going to have our mothers or fathers in nursing homes and say, no, we don't need any inspection of nursing homes. We trust us. We think we're the best. Here's the proof. Look at this satisfaction survey we got. Isn't that nice? Does that look like everybody's happy? That's what's been going on in the developmental disability system. It isn't that there hasn't been some wonderful providers of services. In fact, that has been the case, and that's one thing that's so unique about Kentucky, is that you can find some of the best services you've ever seen in your life. There are absolutely pockets of excellence here where they have great people doing great stuff, but you can travel like 17 miles down the road, and from my perspective, it seems like I've gone back in time 30 or 40 years. It's like nobody is doing that kind of stuff anymore at all, and yet they talk about it as a way that this is, just absolutely wonderful, and this is great, and our families just love it. It's like, oh my, you've not seen what some of these folks are doing some other places.
It's a dug-in mindset.
Yeah.
So where are you gonna find these case managers, these wonderful case managers? Because, I know of one in this area, and her caseload is full. And you know what I'm saying? It's like, and the case managers that I have come in contact with, they believe their job is just to push paper. And, it's not to get, we as parents, we end up being the team case manager to, work with the school and the CLS workers and, everybody involved. So I guess what I'm saying is where...
Well, one, we're going to do lots of training for folks. Second, I already talked about enforcement, people who don't get it or aren't good. We're going to be sure to get rid of them. But the people who are good, and it won't happen overnight, it's going to happen over years. But one of the things we're introducing, it's called, what's it called? That focus
It's,
Oh, what?
we have, To answer your question about the case managers, and I'll tell you what that is. It's gonna grow. We already have, there's several, I think we've had 12 new agencies formed for
Already?
just case management.
I mean, I'm glad to hear that, because, you know, I have talked to people that are so-called case managers, and I'm like, and what is your job?
Yeah.
And they don't even, what they think their job is and what I think their job is two different things.
So we've redone the case management training, and we're right now training every case manager in SCL. Every
Who
current
does
case
this
manager.
training? I keep hearing about this
Our-
training, but
our
who is
staff.
doing it?
We have staff that do that.
Okay.
And so it's a new training the case managers on what their job really is, and the team process, and what we expect it to be doing.
So then do you certify them so that you can say, have you been certified by the state, or have you
All
gone through
providers
this?
have to be certified. So we're
But
not
you can ask,
recertifying.
have you gone through this training with the state, if you want somebody?
Usually they can't bill it, they have
I want Claudia to talk about the tool.
And so also, another thing we're doing is, we took something that was done in another state and we recreated it for Kentucky, and it's called the Kentucky Focus Tool. And this gets back to the question about quality too. The focus tool is going to be used by the case managers. They have to go once a month to a site where the person receives services. It might be in their home, or their residence, or their day program, or where they're working. Every month they have to go to a different site, and they rate the person's satisfaction with services. That is a point-in-time rating scale, so they're going to go, say, to your house, or if a person's living in a staff residence, and there's questions that some of it's through observation, some of it's through talking to the person, or talking to the staff, or talking to the family. And they're gonna look at, how is this person doing? Is the person safe? Is the person happy? Is the person getting the services they're supposed to? And those tools are all gonna be put into a system at some point where we're gonna be able to rate the providers in a better way on quality. And there's also developed quality indicator tools for every service that the providers will be rating themselves on, and then there'll be a check back on that. So we are developing a lot of different quality tools that are going to help develop that so-called report card for providers that will help families make a better informed choice.
That type of thing that Claudia's describing got a special commendation from the federal government, which is unheard of. I didn't know they did anything but beat up on you. But they actually said that they considered it key to keeping people safe and happy
So you might
and
start
healthy.
seeing that already. Case managers are being trained and starting to use that now.
We've trained, the new waivers call for medication administration. We thought it was so critical because we had data that people with developmental disabilities receiving an inordinate amount of medicines, multiple psychotropics even, that we decided to go after that even before the waivers were put into place, and we did. And that took a lot of controversy in that, but we were able to significantly decrease the number of people with developmental disabilities that ever showed up in emergency room visits. We trained how many nurses? About around 300 nurses were trained. What was really interesting about that, we were fought by different people, won't say who we fought with, the usual suspects, but who really wanted it done were the nurses themselves. And it was great, and received the Kentucky Board of Nursing. That's not, what do we call it? It's not endorsement, but what did we get from them? Or maybe it is endorsement.
Yeah, we get their approval basically to be able to use this training.
And it's really cool because, you know, we were one of the very, very first states to get an official, you ever go up before a nursing board and try to get something moved and changed? Remember, they absolutely, you know, they're focused dead on helping people live longer and do good things, period. And to get them to say that our tool was worthy of their saying yes, endorsed by, then it was something good. And it pushes the system quite a bit. But they accepted.
Are you saying when this gets done, it'll be a lot better than what Access had? Because I support Broker Cutting. I had both grandchildren on Michelle. She seen it for 2 seconds, 2 or 5 seconds, 5 minutes. Okay, then when I asked for some OT and other things for my grandson, you won't get it, don't put in for it, hold up the money, blah, blah, blah.
Here's the bit, let me tell you the giant difference in what you're talking about there. The they that would deny such thing will no longer be anybody but our organization or accept it. So that's the big difference. When the Michelle P. waivers all are run by us and all these different pieces, then what you've got is you got people like Claudia and her staff that are in charge, that know something about what they're in charge of. Yeah. So that's the key, and I want you to know that about Secretary Haynes. is she is making some, I mean, she's very quiet, she's very easy to work with, all of that. I mean, when I say quiet, I don't mean actually quiet, she's not quiet. But I meant, and she doesn't make a big show, it isn't all about her. But she's able to do some significant reforms to be able to move pieces that were formerly only under Medicaid, to move them out to be with people who know what they're doing. So she's making big changes in aging also. Big changes at DCBS for Children's Welfare Services. Changes at Public Health. So, and huge changes at Medicaid, and then changes from
What's she secretary of?
What's
Which is
that?
her department?
She's secretary's cabinet.
Okay.
She's my
Cabinet
boss.
of,
Health and Family Services.
Health and Family Service.
Thank you.
What's her name?
Audrey Haynes.
and you are the department head of that
I'm a
department?
commissioner.
The commissioner of
Yeah.
Cabinet of Health and Family
Yeah.
The
Services.
Department for Behavioral.
Yeah, the largest department in government is always the Children's Welfare System, which would be DCBS, and then the second largest is of any government is usually us, which is helping citizens that have mental health needs.
But these changes are very
So
slow going. If any of you have been paying attention to the waiver and how long it's taken to get the regulations done, it doesn't happen fast.
So any given day, then we provide services to over 200,000 people, 200,000 Kentuckians through our department. And on any given day, not any given day, about every 3 days, somebody we provide services to dies. So you should know that because you get services and supports through our department does not mean that you get eternal life. Now, we want those deaths to be as minimal as possible. You know, unfortunately, some of those deaths are called suicide. And what we're trying to do in mental health, I think you'll be hearing more and more about this, is we're absolutely bringing in the very, very best and brightest. I'm working with the military also. I've been in Washington working with the military, and what we're doing with veterans coming back is going to be just, you would not believe how great it's going to be.
I'm a veteran.
To help. Are you? That's wonderful.
I was in the VA program.
Thank you very much.
Get my teeth tomorrow.
And welcome. And welcome home.
Thank you.
But just know that lots of things are happening on that side will make Kentucky respect the folks that have given so much for us.
I have a question and a comment. One, we had Victoria Knight, who's a faculty at UK, that has expertise in the area of autism, at our last meeting, and they have developed a certificate to teach teachers how to, train and work with kids with autism. And as we had them there, we were kind of talking about, gosh, wouldn't it be neat to have someone like you, these faculty involved in developing the training and certification. And I hope you think about that, because there's kind of a cadre of three. There's Victoria Knight, Amy Spriggs, and then Lisa Rubel, that are all in the College of Ed.
Okay.
But they're very interested in, they're very excited about what the program that they've developed, the certificate, but they also are looking at other ways that this information and knowledge could be used within the state. And I hope you would talk with them to be able to get them on your.
Well, Melanie, you're bringing up something that is what's another change Secretary Haynes is making, is that we just signed. We're in the process of signing agreements about the new. As you know, we're building a new hospital here. The new Eastern Hospital. And we're building interagency working agreements with the University of Kentucky. Those interagency agreements had existed a long time ago, and so that there was not a psychiatrist that ever graduated from U of K that did not do part of their internship at there, and then that went away, and we're going to rebuild that. We're going to rebuild that relationship in a way that's going to make that possible, because that's quite a resource. I've become increasingly, I guess you call angry. I travel, as you know, different parts of the country at different times because I have to, but I run across all the time, and I remember I live in Louisville, so don't tell anybody over there. Anyway, I run across all the time U of K graduates that are in very top positions in government, very top leadership positions, different places, who have left this state, and gone on. And Audrey Haynes, of course, is one of those. She was U of K graduate. So and then she ended up working with President Clinton for 7 years. So know that I think, and certainly the Secretary believes, that we can provide real solid interagency agreements with the university, that we can produce a lot. We can keep more of the folks here because they know that they're.
Well, I know you work a lot with HDI, but I guess this group of folks in the College of Ed is sort of, they're not a part of that, but they also, they just bring a wealth of knowledge to it.
Would you just send me, would you mind just sending me?
Yeah,
a-
Harold, you guys work with Harold quite a bit,
Yeah, but
and they're great people too. It's just kind of, in the area of autism, the other
Would you,
question
would you,
is,
would interrupt you a second, would you just mind sending me a note with those 3 professors?
oh, sure, be glad to.
Thank you.
And then the other thing, I work at KIPRIC, which is the State Injury Prevention Program, and what we do a lot is like you look at the cause of injuries and fatalities, you know, and then you use that to go, okay, how do we improve prevention? And are you all, because one of the things I struggle with, and Marie was nice enough to point out in the current regs, the proposed regs, where the language about safety was included, but I don't get a sense that there's a high enough bar when it comes to reporting injuries that don't hit the level of needing to go and be seen by a physician or an emergency room. And are you all, because one of the things I'm worried about is like things that happen in the agency, in the group home, you know, on the job, but maybe are not, they're bad enough that mom would want to know about it, but they're not so bad that we need to go to the ER to get treatment. And so in my brain, you'd still want to know as you look, you know, forward about planning as far as where are gaps, you know, where's area of needs, and is that more of a plan with the upcoming regulation, or is it already there and I'm just not
It's already there.
knowledgeable about it? Because I don't ever see it when, you know, when there's an agency that's on moratorium. I don't know why they're on moratorium.
There's some things that we're working, you remember, everything's working with attorneys also,
Yeah.
and you try to, we know things we would like to say, we know things we'd like to put up there, but that's an attorney sort of issue, you can't do some things like that. But I wanted to say a little bit about what you're saying, just that there's what's called main issues, which is mistreatment, abuse, neglect, and exploitation issues, and that's more serious incident. And just something that I've conceptualized, and Claudia's done a better job than I have about getting all that data. I call it more like occurrences, things that happen that are noteworthy, that don't rise to that level, but by seeing it happen a lot, then it means something. For example, in Colorado Springs, we found that people were getting sick on the bus. So it seems like a no big deal, and if people get sick on the bus, but we noticed that happened a little too much, and what we found is that people's rides were too long, you know, so that was a part of it. They're just too long on the bus, you know, and so people getting sick, and there was different things about, you know, we got rid of all the long buses too. You get sicker when your bus is too long. It was just different things we did. And then, of course, we individualized a lot of the transportation. Well, I'm going to have to get going here. Chris, I live in Louisville, and please forgive me, but.
No, we appreciate that you gave us this time.
One more question before you leave. Where do we go to make comments on the new regs?
I can send Melanie they get sent to Jill Brown, who's one of the attorneys over in the cabinet, and I can send you, if you'll remind me, send me an email tomorrow.
Okay.
I can just, you have until the close of business on October 1st.
And just know this, is that if all they hear, that you know you're going to have people saying negative things because they want to keep the case management money. They want to keep that. You know you're going to hear people say negative things because they want every one of these citizens to stay in those shelter workshops, continue doing those jobs, and continue getting paid. What did one mom get up and testify? And she said this in a positive way. How much?
He makes 49 cents every 2 weeks.
Makes 49 cents every 2 weeks.
How much?
And she got up and said, that's just fine with me, and I want him to stay there. Okay,
That was somebody's mother?
that's testimony. Okay, but I want you to know that kind of testimony, you get a legislator looking right at that and saying,
What?
I don't know, I didn't hear. Oh, Steve, you went over and talked to the folks that have children with autism? We got a lot of good things that come in here. I don't see anything positive particularly coming in here for that. Do you want this changed? Do you like this better, that better, whatever? just know that when we all, because remember, where sometimes we think that our job is to point out what's wrong and assuming that somebody else will take care of what's right, and nobody ever says what's right, and then you get key folks saying, I think the juice isn't worth the squeeze. And next thing you know, what happened to the waivers? What happened to them? Because it's real.
The comments we've gotten so far, I have a stack of paper about like this, and there's 2 positive comments.
So we should send things we like.
I said to the cabinet that every time in Kentucky that you've ever tried to change things, we got to this point, just know that every single other time it ended up in no. Just know it never happened. Never happened. So that's why Kentucky is the only state I know of that's still stuck with the oldest waivers. I don't know if it's the oldest in the nation, maybe close running with some of the other states, but it is the original. The only state I know of that's still stuck with the oldest waivers. I don't know if it's the oldest in the nation, maybe close running with some of the other states, but it is the original waiver. Is still the waiver that's out there right now. Is that original waiver? So know that that's how it happens. Because people like, well, all we heard was negative, and this is, a go along, get along place where people don't like to confront people. We didn't want that to happen, and somebody might get upset, and then we tend to really settle for pretty substandard stuff, when actually we have plenty of money in the system. There's money there, hundreds of millions of dollars actually, to serve these citizens, but the money is not going in ways so that our national core indicators are showing in several categories. We're at the bottom, the worst performing state. For example, in loneliness, the loneliest people. In psychotropic medication, the highest. What was the other? Employment, one of those very lowest in the nation. All kinds of things that we should be nothing but the highest in, but instead we're the lowest because we get the same amount of money as other states get. So why would it be that the state of Washington, a state similar size, by the way, population, why would the state of Washington be spending $24 million on supported employment getting things done, and then we, in our Michelle P. waiver, we're spending, less than $200,000, I believe? Wow. And what you got is you got people deciding that we got a waiver that's built to store people in buildings during the day forever. And so that their life becomes that building to the group home, building to the group home. This long after we're all gone in this room, that becomes their existence. So this is why we're trying to write these waivers in a way to give lots and lots of choices for folks. But believe me, there will be family members stand up and say it. Here's what I said to the legislature. Friday night at 7:30 he called me. And I said, I want you to understand something. Is that we did community forums for all these waivers, and families overwhelmingly said this is what we wanted. We had a 144 commission, we had family members, providers, everybody from every place, overwhelming voted positive yes. We had yes, this is where we want, this is where we're going to go. With all that said, though, and we have young parents that will not tolerate their son and daughter being congregated and segregated only with other people with disabilities the rest of their life. That's all these other families had. They had the choice of institution or the workshop, or institution or a day center. So they said, well, if I can keep my child at home, I'm all fine. I'm fine with it. He can go to the day center, she can go. But it said young families are saying, wait a minute, my son or daughter went to the regular public school. My son or daughter has been around other people. My son or daughter lives in the neighborhood, didn't live in an institution, wasn't living in another state. And I want them to stay here with me. And these waivers are not built for that. These waivers are built for people being separated from us. We wrote these new waivers to mean that these citizens will spend the rest of their lives alongside the rest of us with the supports that they need to be able to do that, so that mom and dad won't forever, they won't have to be dependent only forever on their parents. So that's all.
Is it health and welfare, the committee that?
Yeah.
Okay.
Yeah, Representative Lee is head of health and welfare and one of the best champions that there are of these waivers. But like he told me directly, we're meeting with him Thursday. Again, Steve, these people are in here. They're in here. They're calling.
We're getting comments that are saying, please don't let these regs pass. Please don't pretend this.
Really?
Why?
Is that from providers that are all dug in and they want it their way and they don't want
misunderstanding?
anything new?
It's
from families.
It's one thing.
fear.
Yeah,
You go
fear
say
of
right.
that, you go scare a mom or a dad into believing that you're going to take away a center or a place that their son and daughter has been going to for years. They then, you're harming me, you're harming my child, I'm going to come after you as hard as I can, not knowing that it's all made up, that we're not doing that at all. The waivers won't do that at all.
Parents are being told that if this reg goes through, that your kids are going to end up back in the hospital. Back
But
in
see,
jail.
Where's the misinformation coming from?
Yeah,
Where is
the
the
people
provider?
that are running those day centers that want
Is
to,
it coming
if
from
they
the
want the
service?
status quo, because they're making the money.
Provider Association, their representatives held forums without inviting us, secret forums, with family members in different remote areas of, not in Lexington, not in Louisville, of course, we're much more informed in those major areas, metropolitan areas, but in other remote areas to convince them that that is exactly what we were doing with this. We said, why didn't you invite us? Why didn't you know that these were going on? You know we did all these forums.
They can manipulate people and
But I have
roll them.
stacks of letters from parents saying, please don't pass these regs, so that's all the legislature sees.
I think that's the reason why it would be neat to see juxtaposed in these agencies the salaries of the people that are the executive directors juxtaposed to the person on the other end of the continuum. But I think if you
Pushback from these organizations.
And you already know what it is. Without even saying it, you already know what it looks like. You already know what it looks like.
But that's what's driving all of this is money, you know, because I think if you're fearful that your quality of life is going to be somehow impacted, I'm not going to make as much money, I'm not going to have as much revenue, yada, yada, yada.
Know where we are now. You're not in a place where you're trying to convince me, Secretary Haynes, Governor Beshear. You're not trying to convince us. We're all completely convinced that these waivers are the right things to do. It's what folks need. The administrative branch of government is 100% on your side. Know that. Now, you have the legislative branch. Not that they're mean people, but and some of them are absolutely wonderful. What was it? Representative Rollins and Representative Lee, they both came out and told the providers right to their face, we're for independent case management. We're tired of the fox guard in the hen house. These families need to have people that they can trust with these services, and it's off the table, so it didn't come up anymore in that particular setting. So just know you have some great legislators on your side too, but others just don't know. And of course, that is the very legislators that are, in my opinion, that are often being talked to who don't have any background experience, and all they know is, well, it looks like they're going to hurt some of my constituents. I got to do something about it.
Are there more hearings coming up that you will need people and, let us know. We've traveled.
Well, yeah, there's the legislature, and that's the big thing. That's why Melanie's asking is it's go before health and welfare. That is the real hearing. I mean, we have the hearings now for public input where we're going to respond in writing to it, but then you have the real in front of the legislature type of hearing right in person, and that's the big thing.
Let us know.
You need to go out and have some more. You had seminars where you asked people, what do you want? You gave us what we said we wanted. But I think you need to have seminars to go out and say, here is what it is, because it was like, whatever, 140 pages long. I haven't even read that.
I think those community forums did that.
I don't know it. I support it.
They did that.
I think you've done a wonderful job. You've got people, you're getting supported employment, putting the money so people will be in the community making money. You've got more leisure so people can be out and not be lonely anymore. To me, the waivers are just really wonderful. I think you need a preamble that tells what you're trying to accomplish.
Yeah,
so that I think that would really help. But then I do think you need to go out to us, because the providers got organized and they got their act together on what it is. But we only had 30 days.
Well, remember, fear spreads like fire. I mean, good news is like, oh yeah, everybody always has some good story to tell, but it's just until people experience the good news, until you actually talk to families that are in Oregon, or you talk to families that are in Connecticut, or you talk to families that are in Vermont, or there's a lot of industry that
But I don't fault a parent for writing, because they've been misinformed by, they said, oh, well, now you won't have a day place and all this. They've been lied to, and so of course if they're an elderly family member and they have their kids taken care of, they're all upset about it, and who wouldn't be? But they have been lied to.
Well, it's not dissimilar, I don't think, than from what happened with Oakwood, and people, when they were saying they were gonna move people out of the institution and into community settings, people were like, no!
We know this, everything you heard me talk about tonight, and how I talked about in all the different forms, and by the way, we are going out to other places. But all the things we talked about, if a family member says, you know, we've listened to all you had to say, heard all this, we want no change at all. We want our daughter or our son to stay right where they are. We don't want to go anywhere. We want to be right there at that center. We don't want any changes. I want you to know that's 100% okay with me. It's 100% okay with the federal government, okay with those waivers. You can have no change. But please don't stop other parents who might want something different, might want other choices and options from getting them. That's where I think the problem is. It's like, is that when you scare somebody and thinking something's going to be taken away, then they try to stop something that's going to take it away, when actually there is there's not anything that's offered now that's taken away. All we've done is offer more options and choices and more control for families and people with disabilities to control the dollars, and that is certainly threatening to some of the system. So that's what we're doing, and appreciate your support and advocacy to help us.
Let us know what we can do.
Yeah.